Hello, my name's James Whitworth and I'm one of the medical doctors working at the Leicester Royal Infirmary. This podcast is about taking a genetic test and what that might mean for you and your family members. Genetic tests are usually blood tests that aim to detect changes in your genes that can have effects on health, for example, increasing the risk of certain cancers. These changes are usually inherited, so they may also give information about gene changes in other members of the family, even if they haven't had a test themselves. The tests and the meaning of results vary significantly between the individual genes examined. This podcast aims to briefly recap on some of the more common issues surrounding them that may have been discussed during your consultation. It is important to remember that whether to have a genetic test is entirely up to the individual patient. Test results can have serious and sometimes unexpected consequences, and for this reason, it is vital to fully consider them before entering into it. There are a number of reasons why a genetic test might be offered. It may be an attempt to diagnose a medical condition suspected of having an underlying genetic cause. In the case of cancer genetics, this is usually because the pattern of cancers that occur in a family suggests that this might be the case. There may already be a proven harmful gene change in the family that increases the risk of cancer. If this is the case, it can be more easily tested for to see if a family member has inherited it and therefore at increased risk. If you're offered a genetic test, the next step is to think about what the advantages and disadvantages of actually taking it might be. Tests can often give a yes or no answer as to whether you carry a potentially harmful gene change or not, especially if there is a known change in the family, or the changes that cause a certain disease are well known. This is not always the case, however. Sometimes results may not be 100% either way. Even if a potentially harmful gene change is definitely shown, the effect of it may not be predictable. It may mean you are at risk of a certain cancer, but by no means certain to develop it. If a diagnosis can be made based on the result, this can lead to earlier detection and treatment of cancer. This is often through closer monitoring, or even preventative treatments such as breast removal. People often find that knowing their results can be beneficial in itself, even if the news isn't good, because they feel less uncertainty about their future. At the same time, there may be little effective treatment or prevention available, and people may prefer to live with the uncertainty of not knowing rather than face the anxiety of knowing that they are more likely to develop cancer. Knowing if you carry a genetic condition that can be passed on to children helps many potential parents plan their families. This may be simply because they are able to go into a pregnancy fully aware of the potential consequences for the child, but may open the possibility of testing an unborn baby for the same condition. Genetic testing can also have effects on other spheres of life that you may not have considered. These include getting insurance policies and consequences for employment. Genetic test results are confidential. If you choose to disclose results to family members, bear in mind that they may also be affected in similar ways to you by the information. This is because your result may give them information about whether they are at risk, or allow them to be tested themselves. This may affect their family planning. It may even bring to light issues of paternity, for example, inadvertently revealing to an individual that they were adopted as a child. Clearly, it is important to consider how and to whom you might communicate the information obtained from a genetic test result. It may be difficult to contact relatives with such information who may not share your views about testing. While they may benefit from this knowledge, it may cause them to distress to know that they may have also inherited or passed on a gene change. Genetic counsellors and clinical geneticists can assist with the process and arrange consultations with family members should they wish to discuss things further. I hope you found this podcast useful. If you have any further queries about genetic testing, please contact the Clinical Genetics Department at the Leicester Royal Infirmary on 0116 258 5736. Thanks for listening.